Hello and welcome to this special edition of To The Point. This week we have a special guest with us today. Dr. Nata Menabde is the country representative to India from the WHO. Welcome to the show, Dr. Menabde. Welcome to Rajya Sabha Television. It's a pleasure having you on the show. Before we go into the nitty-gritty of the interview, how long have you been overseeing India as part of your job profile? It's been about 2 years or 1.5 years?
1.5 years approximately, yes.
And how's your experience been in these 1.5?
It's a fascinating experience with so many things changing in India at this point in time, and so many opportunities are there, and so much still has to be done. So it's a fascinating time to be in India and being able to contribute to these developments.
Would you say, saying that India is a developing country with a host of problems in the health sector especially, would you say that India has a lot more problems right now than say other countries that you might have worked in, health sector wise?
Well, India certainly has some problems and challenges that I have hardly seen before, because my previous experience is mostly focusing on the European operations. However, Europe is also a big definition in WHO's terms, so it's 53 countries and they stretch to Far East and they stretch to cover Central Asian countries till Afghanistan border. So I have seen some Asian operations as well within the European context, and challenges are many times different but also similar. So I think India has definitely different significance and different scale of the challenges.
Right.
But some of those challenges can be effectively addressed by not too many interventions that are required to sort them out.
Right. Dr. Menabde, in your experience, you've had a host of experience working in so many other countries around the world. What would you consider India's biggest priority in the public health sector, given the fact that public healthcare in India hasn't really developed to a standard that we would have liked it to? What is the #1 problem that India faces right now?
I think issue of lack of financial access to the majority of India's population to the needed health services of a proper quality is the biggest challenge right now, and it needs to be addressed. And through that mechanism of universality of coverage, that is to protect people from facing catastrophic expenditures when they fall sick or becoming poor because they have to sell all their assets in order to address their health needs, is a big challenge. But having said that, making money available for paying for those services would not be enough. Equally, it is required that services that they get are of proper quality, and that quality is standardized somehow and maintained across the country.
Right. WHO came out with a very interesting statement recently, and I have that in front of me, that India's young nation status is fast withering. Now, what is the basis that you base this, say, argument on? We still consider ourselves relatively young nation. Say if you compare it to China, their age and population is growing older by the day, and we consider ourselves, the average age of our population is around 35. That's still a young nation relatively, don't you think so?
Yes, it is as of today, but we are looking at trends and projections based on the current developments and current rates of growth of different segments of population. And there I would say India has gained a lot in terms of life expectancy that has grew over a couple of decades in the past. That is definitely to be attributed to the overall economic growth and development of the country.
So you see, those two are connected. If economic growth goes on a higher trajectory, so they're connected, that's what you're saying? They
are connected because the economic growth improves people's living conditions, and these are very significant social determinants of health for the people. But healthcare services are equally important determinant, and that needs still to be improved. Now what is happening is that India's population is having greater proportion of aging people above 65 plus category of age, and the amount of these people is growing very fast. So the projections are that from current 7.3% of people above 65, in 2026 you will have some 12% of the population, and by year 2050 the projections come to 17% of.
And these are WHO projections?
There are WHO projections, but this brings you to 300 million individuals in year 2050 as compared to 75 million that you have now.
Right.
So it's a huge amount of people, and that combined with the declining fertility rates and birth rates for that matter in the country will change India's face of a younger population into a slightly different one. maybe I should add here something also, that this rate of growth is very fast in India. If you compare it to, for example, European experiences where I'm coming from, France has taken 100 years to double its population above 65.
Okay.
India, with the current rate of growth, will have only 25%, similarly to Brazil, similarly to China, to get its population doubled in that age category.
Right.
Which means that India will have much less time than France had to slowly adjust its system and develop proper policies. So India has to really move fast to take care of this.
It's a huge challenge, obviously, for India to do that. Also, let's talk about a little about public health infrastructure in the country. We all know, and you will bear me out here, that it doesn't really inspire confidence. Our public healthcare system is not really, it's kind of fragmented, very disorganized at some levels as well. What are the areas that you think need immediate intervention, say for an international agency like the WHO? What would you concentrate on if you had a plan in front of you?
Well, as WHO, we don't really interfere in India's health sector. We support the government and various other stakeholders to deal with the challenges that they have and to bring best advice we can bring. So, at this point in time, the good quality primary healthcare services that are accessible to all are the priority indeed, because India has relatively well developed, at least in the private sector definitely, the secondary and tertiary care infrastructure, with some very prominent institutions which deliver top quality services worldwide. But I think the primary care level is the one that is suffering most, and it's the one which is the most cost-effective one, and it is the one that is needed by a majority of India's poor and rural.
Dr. Menabde, hold that thought. We'll talk a little bit more about public infrastructure and also the role played by local NGOs, but that'll be after a short breather. Don't go anywhere. We'll talk a little bit more about public health infrastructure with Dr. Menabde just after this short break. Welcome back. You're watching To The Point, and we're still in conversation with Dr. Menabde, who is the WHO representative to India. Ma'am, we were talking about public health infrastructure just before the break. I want to get to know a bit about, since you're the expert here, we get to know a bit about the role played by local NGOs and the role they can play in actually developing India's public health infrastructure. I'll give you a small example. I have friends who came out of business school, and instead of going for these six-figure salaries, they started their own public healthcare initiatives in villages, trying to provide healthcare for women in villages as well. How important do you think these interconnected web of NGOs, not supported necessarily by the government, is in actually alleviating the problem of public healthcare or the lack of it in India?
Well, I believe that anything which is driven by the passion and by the desire to see a difference happen in India is really going to deliver better results. And most of the civil society representatives that go into this difficult to tackle area, they are driven by values, they are driven by visions, and they really are bringing that innovation which is so essential as compared to the routinely managed government-run programs, which are sometimes, you know, running out of breath and out of speed. So I think that's what makes a difference. Different spirit, different attitude, different desire to make things happen. And people base it on their personal values and visions. That is something which India should be very, very proud of. I have never seen, I've been traveling, although I worked in Europe most of the time, but I've traveled a lot all over the world for various occasions, and India's civil society is indeed the most powerful driving force in so many things happening currently in India. Now, whether you look at taking care of mothers and children or elderly women or, you know, farmers or in health, in any other sector, there are extraordinary examples of extraordinarily good results being achieved. So I think future of India is definitely in further strengthening and empowering civil society, and government can definitely draw upon the capacity of civil society, especially in difficult to reach areas, especially in the rural setting where the most poor are concentrated. NGOs and civil society can do a lot. and we support them.
But do you, obviously the WHO will support them, but do you think the government can do a little more in ways of helping these NGOs, providing them the infrastructure that they need, probably giving them SOPs like they give industries? Do you think the government can do much more, or do you think the government is doing whatever it can right now and that's far as they can go?
No, I think government can do much more, and the newly elaborated initiative towards universal health coverage, actually, which includes a plan to reach out to all those who need wherever they need, will require multi-stakeholder engagement. That will include public sector, definitely, in terms of, for example, National Rural Health Mission or similar initiatives, but also the private sector to reach out, and very importantly, NGOs to be somehow subcontracted into the scheme and agreed on the quality and the standards and the capacity and package of services that they should be providing to the poor. And that can be happening with the broad engagement of the government, because the discussion on universality of coverage is actually tapping on the taxpayers' money. So government has to manage this process and engage them.
Fair point, fair point. Also, Dr. Menabde, a very important development that recently happened was that India was declared a polio-free nation, of course. That was a big achievement for the country as well, and also all the help you could get from organizations like yours. But do you think, first of all, do you think it's a major development? Of course it is. How big a development it is? Is it for India as a developing nation, announcing that they are free from this dreaded disease? And do you think this momentum can be sustained? Do you think future generations will be polio-free as well if the work at this level is maintained?
Well, it's a great achievement for the world, and India being such an important country where the polio cases have been so much concentrating over the last couple of years, India has made a tremendous progress over these years. By that, bringing confidence to everyone that India can and will eradicate not only polio but many other diseases also. It also shows that India can reach every child with routine immunization programs for many other diseases if it really is serious about it. Secondly, there are only 4 endemic countries, or were only 4 endemic countries where the wild polio virus is circulating, and now we have only 3. India has just been removed after reaching 1 year without polio since January 2011. So it's a major achievement, but it is not achievement which one can celebrate and say that game is over now. We are currently in a very intense phase supporting government's efforts to sustain this success. And sustaining it means many things. It means that national immunization campaigns have continued twice a year, supplementary immunization campaigns have to be conducted, any emergency of outbreak should be responded adequately, vaccines should be stocked for any response for such a polio outbreak. The sensitivity of surveillance system has to be maintained across the country. So state governments should make a lot of effort to sustain this success. Mobile populations, migrant populations need to be monitored and vaccinated. The level of immunity in the population should be maintained very high. Cross-border threats should be monitored very carefully, Indo-Nepal, Pakistan border, for example. So there are a lot of work that is still to be done, but the achievement is great.
Right. Very, very fair point that's just made right now. Of course, we have to sustain this momentum if we have to actually sustain to be polio-free nations. Before we go into another small break, let me ask you a quick question. What are the current projects that the WHO, apart from obviously the polio campaign, is the WHO undergoing right now in India? What are the big projects that you look at in the next couple of years, and what have you, how far have you gone in implementing them?
Well, WHO has just concluded the process of redesigning its strategic collaboration with India, given all the changes that happened in India over the last couple of years, and because we have completed one cycle of country cooperation strategy. So the new strategy, which is starting this year and will stretch for next 6 years to come, is very much looking at universal health coverage, and within that, obviously, at the adequate financing schemes and the quality of services and the support to putting proper quality management system in the country to the government is going to be one of our priority focus areas. The second very important area which I want to highlight is to help India to play its global role in the global health governance. India has been a major player on many of the initiatives of WHO at global level, but it needs to address its issues of communicable diseases related to, threats that India may pose to other nations as well. So there are these global implications of India's role. And obviously, we will definitely deal with the growing non-communicable diseases burden in India and still have to help India to reach its maternal and child mortality reduction goals.
Dr. Menabde, we'll take another short breather right now. After we come back from the break, I'd like to talk to you about the other big threat to India right now is the HIV and AIDS communicable disease as well. We'll come back after break and discuss that. Still in conversation with Dr. Menabde. We'll be right back. Don't go anywhere. Welcome back. You're still watching To The Point. Dr. Menabde, before the break, we started talking about HIV and AIDS and how big a threat it is to India right now. Of course, all over the world, WHO has its offices all over the world, especially in Africa, where the threat is looming large. How badly do you think India is affected by the HIV/AIDS? The HIV/AIDS, how bad is it in India, especially in rural areas and amongst the people who are not really aware about how it gets transferred from one person to the other? How bad is it in India?
Well, on one side, we consider India's HIV response of India to HIV epidemic as one of the most successful programs in the world, because India has avoided what Africa is facing now by properly responding at very early stages. So also, if one looks at the Millennium Development Goals and the goals related to HIV, if anything, India has achieved that goals. India has not achieved the goals on infant mortality, on maternal mortality, although big progress has been made. But on HIV, India has shown good commitment and good capacity to respond. Now, having said that, there are, of course, threats, there are growing numbers, there are issues of mother-to-child transmission, there are lots of programmatic issues, surveillance issues, counseling issues, and that needs to be scaled up in order to maintain and address these challenges which are growing. India is having good program, national program. There have been recently strategic review in connection to 12-year plan. We have contributed to that, so we are very much involved, and we should say that all the major issues in the strategic collaboration level are reasonably addressed. But India still has to put its HIV patients on treatment and to antiretroviral therapy. So there are challenges.
But do you think that there is a social taboo also in India that comes along with HIV and AIDS? Do you think that somehow deters the efforts by the government or by your organization to create awareness about this dreaded disease? Do you think the social taboo also kind of sidetracks the efforts by the WHO and the government?
I think a lot has been done in that direction, and also we have had a lot of engagement with the civil society and at a community level also. So this taboo is still there, but not as bad as it used to be in the beginning. I think there is a lot of understanding.
So some progress is being made on that
Some progress
front.
is being made, especially the teenagers, youth population are being educated on that. So there is a lot of more acceptance to that. But a lot has to be done still, especially in the rural areas. And government has a number of programs for improving that awareness. I mean, recently there has been this, again, train traveling around the country with all the proper messages, which we have helped also to design. So that is a long-term process. It requires a lot of social engagement with the government and with the population, the communities itself. We are certainly working very closely with our sister organization, UNAIDS, especially on the social dimensions of AIDS, and I think there is a improvement that we notice, but a lot more work.
Well, that's good news. Any improvement is good news. It's interesting, Dr. Menabde, you mentioned rural and tribal areas. I want to add to that. Even after 60 years of independence, India somehow, because of problems, systemic problems I might call them, hasn't really gone in to plan public healthcare in tribal areas, in rural areas. How do you think the government can actually, as someone would call it, connect that last mile and get into those areas where public healthcare is sort of non-existent right now? What steps can the government take, with, of course, the aid of organizations like yours, to actually reach those people who have absolutely no access to public healthcare?
Well, it's a difficult issue. I think that a number of initiatives have taken place, such as mobile health clinics and some, mobile doctors going to those population. But the challenge there is that keeping doctors and health clinics in these areas is difficult for a variety of reasons. So one has to look at out-of-box approaches and find proper solutions for that. One of the approaches is to mobilize the local community and identify people who can be trained from that particular community, who would stay there, being perhaps not the fully qualified doctors, but being some sort of community health workers, being paramedical workers, etc. So you have to find the ways to keep people there. Otherwise, that can be combined with the technological solutions that can also be brought into place, and some transportation improvements, etc. But it's not a simple issue, and there are many other things that have to reach to these tribal areas. So you can package health service delivery to those people with other things that need to be delivered.
A double header coming your way, Dr. Menabde. The first part of my question is, of course, do you think, on a purely financial and fiscal level, does the Indian government need to increase its healthcare budget? Do you think the current healthcare allocation just doesn't cut it for a vast country like India?
Definitely it does not. But the Indian government is very well aware of that, and the Prime Minister of India has made announcements in connection to the 12-year plan that at least during the 12 five-year plan there will be doubling of public health expenditure. That is a problem because, first of all, it's a low percentage of total health expenditure, lower than any other BRICS countries have, for example. But also it's a problem because people pay a lot out of pocket. And with such a major challenge of poverty still remaining in India, asking people to pay out of pocket 70–80% of health expenditure is out of pocket in India is a big challenge. So that is absolutely essential. And the government is understanding that and is willing to go ahead with that. And it has to go along with the capacity to absorb this money in adequate manner.
I think recently the Prime Minister made an announcement saying that some percentage of the GDP, it's been increased and the healthcare allotment has been increased to, I don't know the exact figure, but it has been increased in the recent past. You think steps like that are what is needed right now to increase the ambit under which people in India come under healthcare? Do you think that's the right move?
Yes, I think it's a very right move. It's a greatly welcome move, and we have expressed this also to the government. And recently our Director General, Dr. Margaret Chan, has written a special congratulatory letter to the Minister of Health when these announcements came up. It's really a big step for India because it gives hope to India's poor to not be threatened by any disease that they are going to get. And the commitment which government is expressing in connection to this increased level of financing, that is access to any primary care level services and access also to tertiary and secondary level services, is really a big promise and big hope for India's.
Right. Dr. Menabde, let's wind up this interview by asking this very important question. We talked about finance, we talked about the initiatives by the government and your organization as well. Expertise, do you think expertise is something that India can borrow from its European partners or maybe international organizations like yours? Do you think the level of expertise in disseminating healthcare to the rural and tribal areas of the country is not enough right now? Does India need more expertise at this point in time?
Well, I think in the globalized world, we all need expertise from each other. And there are solutions which India can offer to the world, and through South-South collaboration, for example, a lot of this is happening now. But India should not be too arrogant in looking at solutions that other countries have implemented in solving similar problems. And these may not necessarily be all the developed world solutions, but there are many countries who have addressed issues of the major basic healthcare challenges in their countries, and they have had, to some extent, similar context where the good solutions have come. Having said that, I would say that in India today you would have some plots of excellence and areas in which India has shown those success stories in India context proper. So India can borrow between states, among states, between the sectors, and so some of these innovations have to go within the country and also from the other parts of the world, yes. And I think India has to learn a lot and can offer and does offer a lot to the world.
Dr. Menabde, it was a pleasure talking to you. Thank you so much for talking to Rajya Sabha Television. Dr. Menabde was with us. We talked about a whole range of issues. Till next, that's when we end the program this week. Till next time, when you get you another edition of To The Point, it's goodbye from us and goodbye. Thank you.